Okay, everyone, we're going to do a quick little recap on the flu because, first of all, I don't like people being sick, and so anything we can do to prevent that, I want to do. Second, this is the worst flu season that we have had in 15 years. You can tell that my voice is gravelly. It's because I'm just getting over having flu back to back. We all know that I'm an overachiever, and so I always have to exceed everything.
If you ain't first, you're last.
Third, Dr. Mindy is a bossy pants. Yes, it's annoying, but it's also why I'm a good doctor, so deal with it. So tons and tons of cases. We're actually starting to see a little bit of a decline, which is wonderful, but we've still got a few weeks until spring break. Usually spring break is the thing that comes in and squashes flu when everybody's out of school for a week or 10 days and everybody kind of stops passing the germs around so much. So if we can hang in there for a few more weeks, we're gonna get this done together. So what can we do? Stay home if you're sick. Please, 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 and don't just give your kids some Tylenol and head them off to school because that's how it spreads. So stay home when you're sick. It is not your allergies. It's February. It's not allergies this time of year. The plants are not blooming, so if you have an excessively runny nose, that may be early flu symptoms. If you feel like you got hit by a truck, that's the flu. Please get tested either at your doctor's office or grab one of the handy-dandy COVID/flu tests that you can get online or in the pharmacies. It's great now that we have the ability to test ourselves at home. When we talk about herd immunity, it's the duty of the strong in the herd to protect those who are less strong. There are people who are on chemotherapy, people who have suppressed immune systems, babies, or the very old, people who have underlying health conditions. We need to help protect those people by not passing germs, but by also being good stewards when we do have germs and getting vaccinated when we can. There are some people who can't get vaccinated for certain reasons, and so it's our duty as the strong in the herd to protect them.
I'm doing my part.
I'm doing my part.
I'm doing my part.
What to do if you've tested positive? Well, I have good news for you because we can treat the flu if we catch you within the first 48 hours of your symptoms. And I go by when that feeling like you got hit by a truck started. Some people go by when the runny nose started, etc., etc. I go by when the truck hits. If we catch you within that first 48 hours, we have two different medicines that are routinely used these days: Tamiflu, or oseltamivir, and Xofluza, or baloxavir. The difference between these two medicines, well, there are several differences, but oseltamivir doesn't keep the virus from replicating. It keeps it from being released out of the cell after it's replicated inside. It is twice a day for 5 days. Some people have side effects with the medicine and don't feel like it works that well. I'm a big fan and always have been, especially for people who are at higher risk after they catch the flu. As far as Xofluza goes, it's one dose, which is fantastic. It's easy, and there isn't much resistance to it because it hasn't been out a super long time like Tamiflu has. The big difference about it is that it keeps the virus from replicating inside your healthy cells. So instead of Tamiflu, which just keeps it from releasing after, it is a couple of steps back in the whole life cycle of the flu. So people generally get better quicker with that. Now, it's not the case for everybody, and it's expensive if your insurance doesn't cover it. But if you're looking at maybe 7 to 10 plus days out of work, for a lot of people, they feel like it's worth the cost. I certainly did when I had it last week. So don't be a knucklehead. Use your brain. Call your doctor if you need to and get treated, get tested, and help not spread this germ any more than we have to. Hopefully just a few more weeks and we're done with flu season.